Now I'll be measuring hip extension, range of motion. On this patient, I'll be measuring right hip extension. The normal range of motion for hip extension is 10 to 20 degrees. You'll document that as 0 to 10 or 0 to 20 degrees of hip extension. Ensure that if you've already assessed the left hip for hip flexion and you intend to stay on that left hip, ensure that you do switch sides of the table. We'll be looking at his right hip. The normal end feel for hip extension is firm. I'll ask the patient to move their arms over their head so that they're out of the way of the goniometer. And then I'll ask the patient to please lift their right leg straight off the table. So go ahead and lift that right leg. Good. And then lower down. Oftentimes, what you'll see is the pelvis move. So most of the time when I ask patients to do this, the pelvis begins to rotate. You always want to look at that proximal joint to ensure that that is not performing any accessory movement. So you want to make sure you're getting that true hip range of motion. So if you could you just lift your leg without keeping those hip points down into the table? Just kind of lift that right leg off the table. Yes, and you'll see he's actually performing a little bit of rotation of the pelvis. So now what I'm looking for is, again, the greater trochanter of the hip. So in order to find that, it's easiest just to move the patient's femur or ask the patient to move their femur inward and outward as I palpate the lateral aspect of the hip. Once you find that greater trochanter, the patient can relax. I'm going to get eye level with the joint and the goniometer, and the fulcrum will be over the greater trochanter. The stationary arm is again over and along the lateral aspect of the pelvis and trunk. And then the moving arm is aligned with the lateral femoral epicondyle. I will ask the patient to move into hip extension by cueing them and saying, please lift your right leg off the table, keeping your knees straight and your hip points down into the table. And then lower down. So I place my fingers over that moving arm to ensure that it does not come down. And I pull the goniometer away, and I'm looking at his hip range of motion. So his hip extension is 12 degrees, 13 degrees of hip extension range of motion. This is active range of motion.